Early in my social work career, I managed the case of a teenage boy, Thomas, who had severe cerebral palsy, used a wheelchair, had a feeding tube, was nonverbal, and needed round the clock physical care. His mom, Sue, was a dedicated single mom to five children. Because Thomas's needs were so great, making it impossible to hold down a job, Sue essentially had two choices before her. She could raise five children on Thomas's $750 per month in disability payments and maybe a few hundred more in food stamps and housing assistance, or she could surrender Thomas to foster care. When Thomas was inevitably placed in care, his foster parents were granted a significantly higher reimbursement rate due to his high level of needs, $3,000 per month. Over time, Sue visited Thomas less and less, likely as her way to cope and move on from this impossible situation. I changed the names in this story, but this very real case was my first clue among many as a young social worker that something was deeply wrong with the American safety net. This family was divided not because it saved taxpayer money, but because modern American social policy is constructed with a suspicious eye towards people in poverty, lest a child like Thomas and his mother seek to game the system. I'll fast forward through several more years as a foster care caseworker and a decade as an academic studying poverty and welfare policy to tell you that I have come to the conclusion that the pillars of the American welfare system are racism, sexism, and classism. That's how it was constructed and how it continues to operate today. The safety net as we know it expanded rapidly in the early 20th century, including aid to families with dependent children, or AFDC, and several other programs which helped millions of people recover from the Great Depression, but also reinforced prejudiced norms like denying aid to children born out of wedlock and intentional gaps which excluded most families of color. For example, welfare offices in agricultural areas with high African American populations would simply shut down during the harvest season to ensure a steady stream of cheap labor. Other offices had separate sample budgets, one for white families and one for Black families, with the assumption that Black families could make do with less. Many programs had intrusive eligibility rules that undermined the Black family, like denying aid to mothers caught with a man in the house, with documented cases of caseworkers peering through women's windows in the middle of the night. Welfare rights organizers of the 1960s defeated many of these racist and sexist policies and significantly influenced President Johnson's Great Society movement, which expanded welfare roles among families of color and implemented other vital programs like food stamps, Head Start, Medicare, and Medicaid. Very quickly, however, growing white backlash to the civil rights and Great Society movements created fertile grounds for politicians seeking to divert money to the military and corporate welfare against the backdrop of the Cold War and globalization. Politicians like Ronald Reagan juggled these competing demands by employing racist dog whistles like a welfare queen in Chicago to plant the seed in American minds that unwed mothers, especially Black unwed mothers, were exploiting an overly generous safety net. His proposed solution was to set stricter limits on eligibility for assistance. For example, a new rule in 1981 states that welfare recipients can have no more than $1,000 in financial assets, a limit that exists to this day in many states. The idea that welfare rules must be ever tighter to prevent dependence grew among conservatives and neoliberals throughout the 1990s, ultimately leading Congress and President Clinton to replace AFDC with Temporary Assistance to Needy Families, or TANF. This policy introduced 5-year lifetime limits, reduced to 1 or 2 years in some states, new work requirements, excluded anyone with a past drug conviction, mothers who had additional children while on assistance, or who refused to identify non-custodial fathers. TANF also gave states a great deal of flexibility to set eligibility rules and use funds. As a result, state welfare programs are now as different from one another as between many European countries. For example, TANF asset limits range from $1,000 to $10,000 or have even been eliminated in a handful of states. When states increase or eliminate these limits, caseloads don't increase, but low-income families have been found to increase their savings rates in some studies. Similarly, low income limits have been found to create a cliff effect in which families can lose not only TANF, but food, housing, childcare, and medical assistance as a result of even small increases in income, leaving families worse off than before. The result of the cliff effect is an overwhelming incentive to turn down extra hours at work or promotional opportunities when it means the ability to feed and shelter your family or afford quality childcare. President Clinton signed this legislation with two Black mothers by his side in an attempt to signal their support. But the result of state variability in welfare means that states with high African American populations now have lower time limits, lower income limits, lower benefits, more punitive sanction policies, and are more likely to deny aid for past convictions and impose family caps. Meanwhile, child welfare reform efforts of the 1990s, which gave families less time to complete treatment plans and incentivized states to prioritize adoption over reunification, combined with increasing TANF restrictions to create the perfect storm for financially vulnerable families. For example, TANF restrictions for noncompliance are associated with increased child abuse and poor school performance. I can tell you personally that parenting is hard in the best of circumstances, let alone when you're under significant financial strain. And then losing TANF benefits when a child is placed in foster care significantly reduces the likelihood that that family will ever be reunified. Between 1985 and 2000, the number of American children in foster care roughly doubled. Two researchers examined an array of state and federal level policies and demographic factors and concluded that this increase was directly influenced by welfare reform and the war on drugs. It's important to note that these types of restrictions only apply to programs aimed at low-income individuals. Programs aimed at middle and upper income households, like the mortgage interest deduction and tax sheltered retirement accounts, which constitute a much larger share of the federal budget, are designed to incentivize asset building without intrusive eligibility criteria. For example, I don't have to submit a drug test when I deduct my mortgage interest from my taxes. These programs are designed with the assumption that self-advancement among wealthy individuals benefits the entire society, but is destructive among those in poverty. If you break down these two tiers of social policy, remove welfare rules that trap people in poverty, strip them of their agency and human dignity, and harm children, you are essentially left with what advocates call a universal basic income, or a UBI. While currently growing in popularity, this idea is older than America itself. Philosophers have argued for centuries that ensuring everyone is able to meet their basic needs is not only more humane, but it benefits society as a whole. UBI first gained traction in the United States in the 1960s, with proponents ranging from Martin Luther King Jr. to President Nixon. Since then, pilots have launched around the world with thousands of participants with surprisingly consistent results. Basic income decreases poverty and crime, improves physical and mental health. Children of recipients have better school attendance and performance and are less likely to use drugs. Recipients continue to work or even work more when they have the capital to launch small businesses. Basic income gives workers greater bargaining power when they're no longer desperate to accept meager wages. It advances racial and gender equality. It compensates women for the billions of hours of unpaid care work that we contribute to the global economy every year. It gives workers the chance to find meaningful work rather than stay in a dead-end job, and it even creates space for innovation if artists, inventors, and small businesses have the financial cushion to take on risky endeavors. One participant in the Ontario Basic Income Pilot who spent years on Canada's disability support program, told me, "You survived social assistance. I became human again on basic income." Coming full circle to that first case with Thomas and Sue, the other day I spoke with a mother in the Hudson, New York basic income pilot who, like Sue, had a son with significant disabilities that prevented her from working and who is raising her family solely on the little bit of SSI she receives for her son. But now, with basic income, she told me she can pay rent, keep the lights on, and buy groceries. Her family is going to stay together. Right now, a growing number of advocates are demanding that their representatives create a more humane, efficient, and effective social safety net by implementing a universal basic income. And there is promising movement on Capitol Hill, like the temporary expansion of the child tax credit through COVID relief. This policy and several proposals like it are the closest we have been to a universal basic income in 60 years, but we need more voices demanding action. I invite you to join us.